Okay, welcome to Autism Spa. We're here with Dr. Kamran Fallahpour with Vital Neuro. He's going to tell us a little bit about his background, how did he get into this field, and really share some amazing examples of the science and technology behind the company. Dr. Fallahpour, welcome to Autism Spa. We can't wait to hear what you have to say.
Thank you. Thank you for inviting me. So just a bit about my background. I'm a clinical psychologist and neuroscientist, so I have 20-some years of experience in the field. I started really in clinical psychology with emphasis on psychophysiology and brain mapping and so on. So my interest was kind of how neuroscience and research in the past few decades of neuroscience has enabled us to understand more brain dynamics, cognitive processes, and basically how we can do better assessments and also treatments with these new findings that are at our disposal. So I have a private practice, the Brain Resource Center in New York City, Upper West Side, where we see clients here. And we also have some research background. We've done pharma trials, we've done biomedical research in neuroscience and so on. So we've been kind of very active in terms of trying to get into the bottom line of when someone has an issue with emotions, with cognition, with language, with movement, with mood, with sleep. What's at the bottom line? How is it that the brain of that person acts differently and functions differently compared to the norms, which would be like a population that's like similar age, similar sex, similar level of education, and then we can basically compare. And then those findings, once we know what the differences are in brain dynamics, then we actually have ways to retrain the brain and allow the brain to little by little rewire itself to get closer to the norm. And in that process, we actually see symptoms change, people improving their mood, their cognitive abilities, such as, memory, attention, focus, impulse control, the whole gamut of both emotional life and also cognitive life. We can see that change. So that's kind of what we've been doing for the past 20-some years, which is really my clinical practice. And then you also mentioned Vital Neuro, which is really an offshoot of my own practice and some collaborations with Alex, which we talked about earlier, that we are basically trying to put this technology, this kind of intervention, both in terms of assessment and also treatment, out there for the general population, because people who come to my practice are basically local, and they're people who have access to come visit us. But there's a lot more people who can benefit from these technologies and these interventions. And Vital Neuro is really a vehicle to kind of put it out there for people who cannot necessarily go to a clinic like this one to really benefit from what it offers.
Wow. I mean, I think this is really the tenor of the conversation I'm having with a lot of experts, a lot of doctors. Most special needs families have been relegated to deal with the ABA therapies from institutions. Insurance covered, education issued, whether it helps or not, no one seems to care.
Right.
And so I'm really interested to see how what you're doing in your research, not only in your practice, but with Vital Neuro, how that can offer a supplement to families in addition to ABA, if that's
absolutely. I'll talk to you about, and of course the audience too, about generally what it is we do clinically, but then I'll also connect it to what Vital Neuro can do, because probably majority of people don't have access to come see us,
sure,
unless they're in New York City. Then kind of talk about how some of the technology that we have developed can actually help both parents and children with autism and the spectrum.
Okay, sure.
How much would you like me to talk about general? I understand your audience is pretty versed and they already know what autism is, they know the stats, all of that. So,
well, you know what I get, I think the feedback I'm getting, I get families and friends that watch because, not mine, but families and friends of special needs folks that watch and they learn something new about autism that they didn't know.
Let me then just say few words, kind of generalities. Basically, autism spectrum disorders is characterized by social and communication impairments and by restricted and stereotype behaviors, but also there is cognitive components involved. And from person to person, these may vary. So it's a broad range of conditions that are basically characterized by challenges, again, with social skills, repetitive behavior, cognition, speech, and even nonverbal communication.
Right.
So it's really a group of complex and heterogeneous developmental disorder, if you will. And it involves multiple neural system, etc. As far as anatomical brain abnormalities and, there are genetic abnormalities, there's neurochemical dysfunction, and there's neurotransmitters involved. And we won't get into all of that, but we'll get more specifically into the brain dynamics and brain electrical activity, which is really the type of work that we are involved with, and how both the assessment and also intervention or treatment can benefit from this type of imaging.
Okay, sure.
And as far as statistics, I'm sure by now this may be updated, but you're probably aware 1 out of 88 children or something like that, and 1 out of 54 males. So the ratio of males is more.
Right.
So that's kind of generally about that. The genes we won't talk about, but there's no single gene that's been identified. Basically, there are multiple, and there are people who have those genes and don't have autism. So
and some families that have 4 kids on the spectrum, 3 or 4. I mean, right after another. And I think one statistic I also read didn't apply to me because I have 2 boys, one on the spectrum, one not. Is that if you have one child on the spectrum, it's 4 times as likely as your second child will be on the spectrum. My second one was not. He's brilliant in his own way, but he's not on the spectrum. But so many families are struggling with 3 or 4 kids with various degrees of impairment, from MR, mental retardation, as well as all the spectrum disorders, to very mild socialization issues. And all of these folks are diagnosed to be on the spectrum and receive various degrees of help, sometimes not effective to really help them.
Right. So that's important.
Yeah.
So let's get a little bit into maybe EEG, which is electroencephalography. It's kind of one of the imaging techniques that are used often for it used to be more specifically for seizure disorders and some other neurological disorders. But these days, what we also do is quantitative EEG, which is basically much more in-depth statistical analysis and comparison to norms. Mm-hmm. So we can actually look at an individual's brain activity, measure it with non-invasive methods. They're just surface electrodes. Sure. You've probably seen these caps that they put on people's head, and they have sensors. Nothing goes in. We don't just record their brain activity. Sure. And we sometimes take them through some activation task, meaning that some challenges that they do cognitively, process auditory information, visual information.
And if I may add, a lot of families I've talked with didn't know they can ask for their child to be tested for seizures using some of those techniques. In fact, taking the child home, having the monitors on for a day,
Yeah.
seeing how he sleeps. Some families realize that their child was having seizures, they just never knew it. That brain activity.
Absolutely. You're 100% correct. In fact, there are lots of studies that show, and maybe some of them show up to about 60% of individuals with autism have no clinical history of seizures, but they display epileptiform abnormalities. That means the signature of something that is abnormal, that is often found in people with seizure, is present there.
Wow.
So, but let's talk about what EEG is. EEG is really, electrical activity in the brain, that are the neurons in our brain are firing different regions at all times at different rates. And we can actually measure not only the activity, but also the relationship between them. There are norms involved. And, if we can actually compare, again, the norms with someone of that particular age range, then we can say, okay, this is within the norm or it's not within the norm.
Right.
Just a little bit about what these mean. The EEG spectrum usually is measured between 0 to about 42 hertz. Mm-hmm. And then they are divided into different bands. So for instance, delta, which is about 0 to 4 hertz, normally they're observed and they're dominant in deep sleep. Although, individuals could display that at waking time, but it's not dominant. Mm-hmm. Then we have theta, that's commonly seen in some relation to memory process, but also when people are deep into meditative state, in creative states, and another state called hypnagogic state, when people are right before they're like falling asleep and getting into sleep. Mm-hmm. Then we have alpha waves that are more present in a relaxed but wakeful state. And then we have beta, that's more about your attention towards the world and when you are wakeful and just focusing in the external world. And all of those then have other breakdowns and so forth. Mm-hmm. So when we do a brain map, when we do a quantitative EEG, what we're looking at these brain regions, brain activity, and how they are different in this population compared to norms. Mm. And the resting EEG, meaning that at that point, let's say the child or the adult is not doing anything. They're just sitting there with eyes closed or eyes open. We do both conditions. And then we look at their brain activity and then we record it, we compare it to norms. And if I want to kind of summarize the findings that I've seen in my clinic, but also is found throughout literature about autism and quantitative EEG, is that we pretty much have three abnormalities that we see. One is that there is abnormal power. In other words, the voltage, if you will, the power spectrum of brain activity in various regions are not normal. And I'll explain a little bit later how they're not normal. Then we have some level of abnormal hemispheric asymmetry, meaning that the left and right brain don't seem to be functioning similarly. Of course, in normal adults, that's also the case, but not to this extent. Then we see also something called a coherence abnormality, meaning that the different regions in the brain communicating to one another is not normal. Mm. And I'll go a little bit deeper on these. That basically when it comes to power or the power of the electrical activity in the brain, basically both my observations in my clinic and also the literature suggests that there is a U-shaped pattern of power abnormalities, which means overall, there is, if I want to kind of think about a graph, delta and theta power are increased, beta and gamma are increased, but alpha is decreased. In other words, compared to norms, these are the abnormalities that we see in this particular population. Lower alpha, but everything else is kind of high.
Interesting.
I can actually show you, maybe,
Yeah.
let me see if I can share my screen and see if I can show you an example of that. Let's see. Because visually, I think it's good to see what that looks like.
And whether you have autism or you're on the spectrum or not, I think every human being will find their brain patterns interesting.
Yes, absolutely. So I don't know if you can see the screen.
Yes.
Okay. So here we have from 1 to 42 hertz, and exactly similar to a lot of research that's been done in the field. This is from my own clinic. Mm-hmm. And we're looking at increase in slow activity, the red that you see here from 1 to about 5 hertz.
Wow.
Then we have increased beta. We have everything about 13, 14 and above. It's all escalated. And the blue denotes the lower power within 7, 8, 9, 10, 11 within alpha. Okay, so it's pretty much consistent with what the literature says. And this is, again, from a child that we record. We've done a lot of brain mappings with children and adults with the spectrum. And then this is one of them. This was an 8-year-old male.
And was this over, these are just snapshots of the brain patterns over certain...
Absolutely. These are snapshots for that particular day. But we've done studies that looks at morning, afternoon, evening, and across weeks or months. Yeah. The brain, unless something happens, let's say traumatic brain injury happens or severe changes or medication, pretty much the signature stays the same. In other words, if I got your brain map today and you came back in a month, it's pretty much the same, unless, I don't know, again, you were really fatigued or you didn't sleep the night before, something like that.
Or I've mapped out some new neural net.
Absolutely, which is the way to go. Absolutely. Yeah. And treatment, by the way, we do see these patterns change.
Right.
They normalize in line with the protocol, and we see symptoms improve in line with them.
So that's interesting. So even if the child is nonverbal or otherwise can't tell you, you can see that there's been a change in brain patterns based on therapy or other input over time. And you can maybe choose to then adjust your therapy to encourage that pathway, whereas you wouldn't know before.
Absolutely.
Wow, that's new knowledge. That is something that I think most families or most therapists aren't dealing with. They're literally, in some ways, flying blind because they don't have a gateway into a child's mind, and you're providing that gateway that actually can lead to new therapies that
100%, and rewiring yeah. Wow. And by the way, we believe that this is not only for, let's say, children or adults with autism or like ADD, ADHD, or someone with a disorder. We believe that everyone should learn more about their own brain dynamics. And tendencies towards obsessiveness, towards anxiety, towards depression, towards hyperfocusing or not focusing, towards impulse control, mood regulation. All of those, they are basically apparent in one's brain signature, and we can actually look at it. Wow. And then you can see a change across time as they work on it in treatment or with other methods.
As I've tried to advise some of my younger family members about changing their behavior or trying to find a new pathway, I describe it as a cornfield. Your life, the pathways you've taken are beaten down corn in one direction. Those are familiar, those are seen. You don't have, but if you want to change your behavior, change the way you react to issues, the way, like you say, the impulse of negative thinking, of anxiety, of depression, you have to start beating down a new pathway on the cornfield.
100%. That's a very good analogy, and that's exactly how it is. The more you reinforce a pathway, the more robust it becomes. And the less you travel that old pathway.
That's right. That led to anxiety or depression or negative behaviors or negative impulses. You begin to map, and this is the elasticity of the brain that I think most scientists talk about. It's never a done deal. Sometimes you say, well, you can't teach an old dog new tricks, but the brain is forever elastic and able to learn new behavior. That's how therapy works. That's how you can change behavior by changing brain patterns.
Absolutely.
Sounds like.
Yeah.
So as you see this, I mean, let's say a family is given that sheet with their child's snapshots in it. What comes next? I mean, what do they do with it?
Yeah, what comes next is the actual intervention, which is often a combination of brain-computer interface, neurofeedback. We have some other methods that are even a little bit more aggressive, I would say, but usually with children, we don't use those methods such as TDCS, RTMS. You know, there are all kinds of methods of what we call neuromodulation techniques that we use to help the direction of rewiring the brain towards a healthier brain and towards kind of brain wellness. And we actually see improvement in symptoms.
So we don't quite shock people anymore, like 100 years ago, I don't know. But there are techniques that you can, for children especially, and adults, to help them remap their brain in a positive way.
Or like an exercise, rather than, just kind of zapping the brain with some, electricity. We actually teach the brain how to rewire.
And you can then monitor it to see if that teaching worked. Literally, you can see a snapshot.
Absolutely. And when we go to the next kind of section where I get the brain map up again, maybe to show you something, I can also tell you how the treatment is done. Okay. So the second part of brain abnormality has to do with actually the asymmetry. The left brain seems to be a lot more hyperactive beyond what's actually efficient for the brain in these individuals. Then we also have something that we discuss about the coherence. The coherence is how the different parts of the brain talk to one another. So again, I'm going to go back to this brain map, but this time I'm going to show you aspects of how the brain, like let's say these regions from the frontal lobe to the back, have statistically significant hypocoherence, meaning that the frontal lobe, which is really responsible for a lot of higher functions, and obviously the language production is also here on the left, but there's also attention, focus, executive functions, all of those things that in this spectrum disorders are implicated. The frontal lobe is not really communicating with the rest of the brain as much as it should, but it is over communicating with neighboring regions,
right?
Which is quite interesting. Which means, in a way, imagine if you have an organization, if you have a corporation, and the different departments don't talk to one another and they don't communicate.
Right.
So information doesn't get around and things cannot be done properly. However, there is too much talking within each room, which basically means, again, not much is happening. They're just talking to one another, but nothing gets out of there and nothing gets communicated. So that's kind of an analogy to kind of understand this coherence business. But going back to your question about, the treatment, let's say once we understand where these abnormalities are exactly, rather than mapping the whole brain each time that the client comes in for treatment, we just put a sensor in one area that's indicated based on their brain maps and symptoms. And we just train that region, either in this case, let's say, we want to increase some of this alpha that's missing or decrease some of the slow activity or fast activity that's like hyperactive. So that is the methodology that's used really to help rewire the brain. Wow. And of course, it's more involved, but from the user point of view, the child basically is sitting in front of the screen and interacting with that with their own brain And to them, it's like just a game. But in fact, the game is helping rewire the brain.
So do most kids, are they able to sit in front of a screen for extended period of time, or are you chasing them around the clinic room?
Excellent question. Depends. Like, we are a lot more successful with mild to moderate.
Sure.
Because with severe, autism, as you know, it's very difficult to have them seated, difficult to put the cap on, because there's also often kinesthetic sensitivity. They don't want to have anything touching their skin often, or a hat even. Sensory integration issues are common. So because of all that, it's very difficult to get them to do that if it is severe. But in cases that are mild to moderate, we've done a lot of work that has been successful. I'm not saying with severe, it doesn't help. It just takes 10 times more work to get a little...
it's like a haircut. I mean, some kids will sit for a haircut. Some things you have to chase them around the barbershop on the floor trying to cut their hair. But it's possible to do this with severe kids. If they don't, I mean, I understand obviously the sensory issues. Some kids, like my son, he's able to submit to touching, but he won't understand what he's doing there. And on the more severe side, again, if you have mental retardation, will any of this mapping work?
Well, the mapping works. The question is, can we get their attention to engage in this process of feedback,
right? So
we can rewire the brain.
Okay. So let me rephrase that. Well, if someone is mentally retarded, MR is the clinical term, I think, and they can sit down for that attention, the brain is able to rewire itself.
To some extent.
To some extent, okay. To a lesser extent because of that impairment, but otherwise there is some ability to improve functioning with rewiring. So even if on the severe side you have kids, then it's possible. Okay.
But I can tell you it's a lot harder with severe than with mild, moderate. So
well, I guess I can't speak for all the special needs parents, but special needs parents are resilient, and special needs kids are even more resilient because they're able to manage their life to some degree with a lot of help, with a lot of impairment. And I think, these warrior parents are able to do anything they need to for their kids to improve their quality of life. And like I tell others, not to be some image of what parents think they should be, to be the best they can be to whatever degree. So
absolutely. And I know it is so difficult to be in that position, because over the past couple of decades, I've seen dozens of parents, and I know that it's often so exhausting to go through, all the things you have to deal with. In fact, that may be a good segue to talk about Vital Neuro. We did a pilot study with using some of our technology with parents of children with autism, because obviously they're some of the most stressed individuals.
That's right.
With all the demands and all that.
Right.
And then we had 13 subjects that completed just a 15-minute session daily with this headphone that has sensors on the brain and does a specific protocol for reducing stress and, getting in deeper into states of meditation.
Right.
And I'll share with you this graph here that shows the results of that study. As you can see, these are all standardized clinical tools, that questionnaires that are used. As you can see, this is the level of the pre, and this is the level of post, with anxiety, depression, and stress.
Wow.
And the combined scores. So basically, they found it to be extremely helpful to be able to spend 15, 20 minutes a day for self-care, but not any type of self-care, one that's really focused, laser-like in getting you into a deeper state of meditation, relaxation.
Wow. Well, I always tell myself and Other parents, I never pray for a cure. I pray for strength. That way, some days it comes, some days it doesn't.
Right. Yeah.
And I think when people look at therapies like this, they should understand that it's progress. It's not perfection. It's not a magic pill. It's meant to improve the quality of life for these kids. And even if that chart was half as effective as it was, I'm sure many parents would dive towards it because it improves the quality of life and reduces stress and anxiety, especially for those, even if it's moderate. If moderate kids can go to be very mild, then that's a huge move forward.
Absolutely. And with when it comes to Vital Neuro and this particular platform, what's most helpful, aside from helping parents obviously cope with the stress,
right,
for children and adults with autism,
right,
basically it does two things. One is that it helps deactivate if they're stressed or agitated, and in those states that often we know they get into.
right.
But it also helps build the higher functions such as attention, focus, executive functions, and emotional regulation.
Wow.
So those two, I think, would be a great aid to any child or adult with autism as well.
Well, like I said, I think a lot of folks come to me, parents that have typical kids and obviously special needs parents, and the folks that don't have special needs kids, they complain about a problem or they're stressed in their life, and I tell them, you know what, I understand what you're saying, but that's not a problem. This is a problem. That's an everyday life. So some of this relaxation may help ordinary parents just deal with the stresses of life, but the fact that it's being applied to special needs parents, as you say, the most stressed out, I want to say class of parents, I think, or any parent dealing with a childhood issue. It could be cancer, it could be any number of things. It's a stressful thing, and to improve the quality of life for their kids or adults, I think parents would do anything to just make that incremental
experience. That's been my experience, and I've been I think parents who are dealing with this, they are so brave, and they are so I see parents do so much, and I'm like, they're resilient. They're doing something that most people don't believe we can do.
Yeah.
to deal with that level of stress day in, day out.
Yeah, you're right. We talk about elasticity of brain. I mean, I think people are, they never know what they're capable of until they have to do it.
Absolutely.
And as far as relaxing, that's why I call my platform Autism Spa.
Yes.
Take a spa day. Yeah, thank you.
It's a great name. And again, the only other message, I guess, as a clinician I have for parents is self-care for yourself is a priority.
Right.
And 15-20 minutes a day minimum. And if you don't do that, you cannot care for your child the same way.
Right.
So that's the most important thing that I believe, can help people continue to give the care at that level. Right.
And I think that's really the key message. Take care of yourself. A lot of parents, I observe, unfortunately, obsess over the care of their special needs kids, and that's admirable and that's wonderful, and that's life. Parents, are like that. Every country, every religion, every age. Once you have a child, your whole life changes, and you're just revolving around that child. Once that child is diagnosed with special needs, then you become obsessed and you forget yourself. And I think you need to have a good, constructive, healthy family environment, and the kid picks up on that, as I'm sure your brain patterns will show. So if you're stressed as a parent, you will pass that stress on to your child. Yes. So trying to relax and take care of yourself, and then trying to find ways for your child to relax, not a cure, but just be able to understand the brain patterns that are impacted by their impairment, and how therapies and relaxation can help them improve their quality of life is just, I think, a godsend. I think that's the right track as a supplement to any other services they're getting through any other platform. But I'm so glad we had this time, Dr. Fallahpour. I think your work is immensely important. We will have all the information about Vital Neuro and your practice on the post. We will keep in touch, and if there's new developments with the technology or the therapies, please come back and tell us about it. I would love to share it with our group.
Absolutely, I'd love to, and we'll stay in touch, and I'm sure that we can have another chat in the next several months to come. We actually are launching Vital Neuro platform by the end of this year, and that might be a good time for us to come back.
Perfect. Thank you so much. We'll see you soon.
Thank you for inviting me.
Sure.